I heard it snap and I broke 2 bones in my arm.
And she's here today because she gets to choose any color cast she wants, and she's chosen sky blue.
Yes.
Right? So. We're orthopedic surgeons, so a lot of the patients who we see you would think need surgery, but actually orthopedics deals with all sorts of fractures and bruises and strains. So I would say in the neighborhood of 20 to 30% of the patients we see actually need surgery.
Dr. Johnston did a total hip replacement and it went very well. I was in a lot of pain before that. Right after that, I was upright. People that I work with made the comment that, you know, it's nice to see you standing up straight again because it made such a difference. It made a difference in my life. No pain. I can do anything. I mean, I made the comment that I have the hip that I was born with now. I mean, it's that much better.
All right, Karen, so this is a steroid shot in your left knee. Offices that we have now are completely redesigned in the last year, and it's allowed us to get people in the door in a more efficient way so that they can be seen when they need to be seen. So we now have walk-in hours 8 to 10 Monday through Friday, and we also have an evening clinic Mondays 4 to 7. The reason we did that is we kept on hearing from patients and from primary care doctors that the patients wanted to be seen right away. And we think it's better to come be seen here by an expert right away rather than going to the emergency room and waiting for a long time. So when patients come in, the goal here is to keep them out of the waiting room. And then what we want to do is bring them right into a room. Our practice here at GBMC Health Partners Orthopaedics has 7 orthopedic surgeons, and we all have specialties. My particular specialty is hip and knee arthritis, but we also treat general problems like fractures and injuries in sports and injuries to children. And this will just take a minute to dry, and then we'll wear that for another 2 weeks, and then we'll hopefully be able to get you into a waterproof cast. Okay? A patient comes in from on stage, and then we come in from the backstage, can enter the room, see them, and then they can get in and out fairly quickly. They took a lot also from something called Family Care Associates, is one of the primary care groups here, and they have the same setup where you have the backstage area where the providers can talk back and forth and discuss problems and review x-rays and collaborate, and then you have the clinic space that you can walk right in and see the patient.
They walked me through the process, everything that you needed to know about what you should or could do before the surgery, what would happen with the surgery, and what would happen after the surgery.
You know, when I occasionally deal with my patients when I'm pre-opping them and I know they're having that procedure done, you know, I tell them what my experience was, and I think it makes them feel pretty good to hear that I came through it like I did. I've put it to the test. I mean, 7 weeks after surgery, I was skiing, so I know. I mean, I could do anything.
Trampoline injuries, slip and slide injuries, a lot of monkey bar injuries, so kids slip and fall. For most of the simple fractures, we can treat it with a cast right here in the office.
The instant relief from the pain disappearing in the joint, whether it was mild like mine or acute like some other people, once the surgery done, it's gone.